Hello, I'm Dr. Agatha Thrash from Uchee Pines Institute, and we're going to talk about pain during the next half an hour. We hope you'll join us.
The following program presents principles designed to promote good health and is not intended to take the place of personalized professional care. The opinions and ideas expressed are those of the speaker. Viewers are encouraged to draw their own conclusions about the information presented. Welcome to Help Yourself to Health with Dr. Agatha Thrash of Uchee Pines Institute. And now, here's your host, Dr. Thrash.
At Uchee Pines Institute, we deal with pain in a lot of ways. We deal with a number of different kinds of pain. Pain can usually be categorized in two ways. We can talk about chronic pain, or we can talk about acute pain. Acute pain is usually treated in a different way than chronic pain. And this is Don Miller, who will be talking with me today in helping you to understand how we treat pain at Uchee Pines Institute. Don?
Well, Dr. Thrash, there's various ways that we treat pain, and one of the first things is what we do within our own minds to make pain worse. We call these things pain intensifiers. It's basically our reaction to the pain perception. The first and probably the greatest thing that intensifies our pain is fear. Fear does a number of things to the body physiologically. Fear does a number of things to the body mentally. Physiologically, we tense up. Our muscles become more rigid. You remember back in the days when you used to get hypodermic needles shoved into your muscles, they'd say, relax. Yeah, really right, relax. Here they got this great big long needle. They're going to ram it into your muscle and they tell you to relax. Well, normally you don't, and you're all stiff. They run this needle into your muscle, and that stiff muscle hurts more than if you would have or could have relaxed in the first place. But it's also the fear of the unknown. When we get a pain, we wake up in the morning and we've got a pain, and we self-diagnose ourselves. What could this pain be? And we start coming up with all types of horror stories. We read an article yesterday. We heard a news broadcast about this pain and this great disease that's caused by it. And pretty soon we're thinking that we've got that disease, and the pain becomes much, much greater. And then we go to a physician. He diagnoses our pain as being we slept wrong, and all of a sudden the pain's not quite as bad anymore because our pain's been somewhat palliated by the fact that our fear has been assuaged. It's a nice way to take care of the fear and the pain. Another thing that intensifies our pain is guilt. The old, these are for people who are basically pain prone. They're guilty. I shouldn't have done that. If only I hadn't done that. If I hadn't eaten that, if I hadn't done that, if I hadn't done this thing over here, I wouldn't have this pain right now. And so this guilt complex seems to make the pain much, much greater. There's also the thing called anger. Now we're talking again about how the mind is reacting to the pain perception. The pain's the same, but now we're angry at somebody or something. We are angry at the accident. Why did that happen to me? And often when we start asking those questions, we become angry at the very one who can take care of our problem. That's anger against God. And so we're angry against God, or we're angry against our spouse, or we're angry against our employer, or we're angry against ourselves for doing that stupid thing, falling down the stairs, tripping over whatever, and we get angry. And all of these things along the lines are making our pain much, much greater. Really a great pain intensifier is a thing called loneliness. People who are alone suffer more pain. And we'll talk about that a little bit more when I talk about things to assuage or take away the pain. But people who are lonely seem to have a greater perception of pain. We find that those people who are alone suffer more premature deaths. Matter of fact, double the national average than those who are not alone. Divorced people are 5 times more likely to commit suicide and die in fatal accidents 4 times more if they are alone. These are sad circumstances for a person. They did some experiments. Matter of fact, one experiment I think about back in 1956, they had in a hospital ward, they had those people in an open ward seem to use less pain medications by about they took about 3.2 doses of pain medication to those in private rooms, about 13.4 doses of pain medication because there was more going on around them. They weren't so lonely anymore. And so we take away the loneliness, we often take away the pain, take away the anger, take away the guilt, take away some of these things, and we find that they have far less pain. And so when you're looking at pain, we're not just dealing with the physical response in the skin, in the bones, in the muscles. We're looking at the mind's perception of why do I have this pain? And as we can rest in the Lord with this pain, as we can accept it as Job says, though he slay me, yet will I serve him. We need to get that attitude, and we'll find that our pain oftentimes will be just going away with giving it over and saying, I'm going to accept this and get a right attitude about it. Dr. Thrash.
We only treat acute pain with drugs, such things as in anesthesia or when there is a severe injury with intense pain. Those can be properly treated with drugs, but it's easy to see why we would not want to treat chronic pain with a drug. The person becomes dependent on the drug, and increasing quantities of the drug are needed until the person is hysterical without it, and may even develop a sort of personality problem or become a hypochondriac. And they may describe their pain as terrible or horrible, but when you look at them, they look as if they're coping pretty well. And so what we need to do is to find ways that we can relieve pain and make the person quite comfortable without using a powerful drug medication. And some of these very important ways to treat chronic pain are heat and cold, or even alternating heat and cold, where we apply the heat and then right away apply the cold, even in the same treatment. Or we can apply heat for one type of pain and cold for another type of pain. Or it can even be that one person in one type of pain will enjoy having heat, but another person finds that not pleasant. And so you must sometimes treat with heat for the same kind of illness that the last person you treated with cold, and it was quite satisfactory. Sinusitis should be treated with heat for the most part. They can sit in a tub of very hot water, and that often relieves their pain very nicely. But cold applied to sinusitis will sometimes make it worse. But the occasional patient will find the very reverse. Cold applied makes it better. Now, heat can also be applied for such things as a sprained ankle. But sprained ankles, for the most part, will be better treated with the cold, an ice pack or something of that nature. We also find that pressure is good. Pressure can be applied by the hand. When a person has been acutely injured, sometimes if you press on the place where they've been injured and where they feel pain, it will help a lot. You may have noticed that if a finger gets crushed and you put pressure on it, that can help quite a lot. And then in such areas as tennis elbow, we can put pressure. And I've asked my granddaughter, Melissa, if she will help me show you this kind of treatment for a tennis elbow. This is Melissa Thrash, and Melissa is, let us say that she has been doing some kind of activity that causes a rotational movement of her arm. We can easily prevent this kind of pain from developing by simply applying something like an ACE bandage. Or if you prefer, you can purchase from a drugstore a little band called a tennis elbow band. And so this is simply wrapped around the arm in this way, and the person wears it doing whatever activity they are doing, whether it is shoveling or hoeing or whatever they may be doing. And it's a very simple and very nice treatment. Then when they have finished with the activity, they simply take the band off, and that enables them to avoid getting the tennis elbow. Now, another thing that you will find is a real problem is that of arthritis, and people have pain in their hands and especially when they wake up the next morning, they have pain in their hands. And so I'm going to ask Melissa to show you how she would handle that with these gloves. They look as if they are child's gloves, but they're actually large enough for an adult. And so the treatment is very simple. We simply use a pressure on the hands so that the next morning the person wakes up and they will tell you that their hands feel much better having just had that little bit of pressure on them. Right? Now, another thing that's very important is that of water. You might think that water is not a good treatment for pain, but we find it quite excellent. And I don't know exactly why it is that it works all the time, and it doesn't work in every kind of pain, but in most kinds of pains, people will find it better if they simply are well hydrated. And you can take a glass full of water every 10 minutes for an hour. That's a glass full of water every 10 minutes for an hour. And it will often relieve such things as headache or abdominal pain or sometimes skeletal pain. I think it may separate the nerve fibers that cause those kinds of pains and make the person feel a lot better. And now Don Miller is going to tell you about some other ways that you can handle pain. Don Miller?
I talked a few minutes ago about helplessness and loneliness. Loneliness is the one that really seems to get us the most. Picture the scenario. The child's running down the street, active with the friends, falls and skins up the knee. A little bit of blood. The child sees the blood, immediately is scared. Runs home to mama, crying, it's hurting terribly. What does mama do? Mama holds the child, kisses the child, says it'll be all better. And it's amazing. Just those words seem to make it all better. And then puts a Band-Aid on it and sends the child back out to play, and the child's perfectly fine. Doesn't even think about it anymore. Until that night, mama kisses baby to sleep, lays her down, covers her up, turns out the light, and now what's left? In a dark room, no stimulation, and what happens? The pain comes all back again. Because that's where the mind is. All during the daytime, you had mama sitting there comforting the child. You had activities going on all around. You had the other playmates, things to do. Now there was nothing left to do but focus on the pain. And we need to keep from focusing on the pain. And there's ways of doing this. I've read situations, I haven't quite gotten to this place yet where you go into the dentist office, and I once tried it. You know, I went to the dentist office and said, I can do it without the pain medication, thank you. And so they put me way back there in the chair, and he opened my mouth, and he went in there with that drill, and as soon as I heard that, I tensed, and as soon as it touched my tooth, he took it back out of my mouth and he gave me the shot, because everything in my body told him that I was going to really be a bad patient that day. But if you would find some way to divert the mind to other stimulation, you only can perceive so many things in your mind. Now, right now you're sitting there and you're not really aware of the fact that your back is pushed against a sofa or a chair, and the watch band is pressing against your wrist and the top of your socks or against your leg. You don't feel or notice all of these things, although you do have true perception. So we can get more stimulation going in that's pleasurable. We will have a less tendency to focus on the pain that's also coming in. And there are ways of doing this. And one of these days, don't hold me to this, but one of these days I want to try going to a dentist office with a friend and say, as soon as that guy opens my mouth and heads for it with the drill without the Novocaine, I want you to take perhaps something as simple as a hairbrush and start stroking perhaps my arm or my leg. Or you can reach up and just take your fingers and give me a little scalp massage. And at the same time, perhaps take some type of a perfume and put it on a handkerchief and let me be smelling. So now I've got some olfactory senses coming in here, and I've got some senses here from touch. And perhaps I can take a CD and turn on some music, so I'm hearing some music going on at the same time. Matter of fact, with headphones it's even better. Then you can't hear the going on, because basically if you've been inside a dentist office, even sitting out into the waiting area, when you hear the drill, you tense up. And remember, we talked about this tensing up which is one thing that amplifies pain. Another thing you can do is have some type of little massage techniques. Now, someone can give you a massage, or you can take your foot. This is a little foot massager, and you just take your foot and just slide it back and forth. This gives you a very nice sensation, which will sort of overwhelm the other sensations going into the body. And so if we find ways of sort of overloading the brain with other sensations, we'll find that that pain that is usually rather acute, if we're just focusing on that, will seem to go away. I had an experience one time. I was in Ukraine in the wintertime, and a neighbor of the place I was working had fallen and severely twisted and wrenched his back. There's a big Ukrainian man, big burly guy, crying. He was in so much pain. We got him laid down on this couch of the nearest house. He could not even go home. He was in so much pain. So we put him on the couch of the nearest home, and here he was, and I had a doctor from Ukraine with me, and she examined him to make sure his back wasn't broken, because he walked in, so it wasn't broken. But now, what to do with all this pain? And so I says, well, go out and get me an icicle. So they went out and broke a big icicle, and there are big icicles in Ukraine, big Texas-sized icicles, and brought this big thing in here, and I got a pot of hot water, and I dipped the end in to sort of smooth off the edges, and then I started massaging that back area. Well, now you had a different sensation going on. Now it was cold, but at the same time, I was taking another part of his body and I was massaging another part of his body. I forget whether it was his shoulder or his head, but I was massaging this other part of the body while I was massaging the back with the ice, and pretty soon he was complaining because it was cold. But then he got up. He didn't have any more pain. Not that the situation was fixed. He still had a sprained back, but the ice had taken the pain away enough that he could go home that night pain-free and deal with it that way. And so as we find ways of diverting the mind away from ourselves, at nighttime when we're all alone is when we hurt the most. So we need to be doing something. And I like that saying, if you can't sleep, don't count sheep, talk to the shepherd. When you have pain, talk to the one who knows all about your pain. He went through the pain too, and he'll help you through it. So as we talk to him, as we get other senses involved in this process, we'll find that pain will be saying, sayonara, and that's what we wanted to do. Dr. Thrash.
Another kind of very good treatment for pain is that of counter-irritation. You may have heard your grandmother talk about her liniments, or some neighbor may talk about their materials that they rub on that come from a store, such as capsaicin or cayenne. It's a red pepper extract, and you can get it from almost any store. And this kind of red pepper, when you put it on the skin, will help you greatly with the counter-irritation. Now, there are many other liniments made from camphor, from menthol, and some other counter-irritants that are a little irritating or a little icy feeling on the skin, but when you use it in times of pain, it can actually take the pain away. Now, another type of counter-irritation is something like this. You may not have seen this because I picked this up in Korea, and I like it very much because it can be self-administered. If you have a pain in your back, you can just do this kind of thing, and it helps enormously with the back pain. And then you just can do it on the other side as well. But let's say your pain is not in your back, your pain is in your foot or in your abdomen. Will this help with that? Yes, it does. Do the same thing. You can apply it here and here, or you can apply it on your arm or your thigh or elsewhere. And interestingly enough, it is as Don Miller was talking about with the gate theory, which is that you simply overload the senses with as much as you can in the way of other sensations. And it is theorized that there is a gate that goes up to the brain that allows a certain number of impulses to go through, and if you've put other impulses in, then the pain will not feel so bad. Now, another thing that you can do to help your pain is that of control the diet. I mentioned already about drinking water. A lot of water, keeping well hydrated, will also help you with pain. But the diet in pain control should be very simple. It should be non-inflammatory, which means that it should not be heavy in spices or vinegar or heavy with salt or sugar or fats. But in this way, you can help yourself with diet. The very best diet in pain is the kind of diet that we recommend as the least inflammatory, the least likely to be irritating, and the least likely to cause you to get a chronic disease. And that is the totally vegan vegetarian type diet. That means fruits, vegetables, whole grains, nuts, and seeds. And as these are eaten in a very simple way, not too many at one meal, then the person can find that a chronic pain will be very much helped by that. If you're overweight, be very careful not to overeat. And just the very act of not overeating will also help you to deal with pain. Now, Don Miller is going to talk with you a bit about herbal remedies for pain control. Don?
Okay. You know, I think one of the herbs that we like to use for pain sort of works on the gate theory also. The herb is called valerian. And if any of you have ever worked with valerian, it's the smelliest herb I've ever smelled. And I think basically by drinking a cup of this stuff, your mind is so overwhelmed with how bad it smells, you forget how bad you feel. And so maybe that's the gate theory, but I'm sure it also has some type of an analgesic effect. But there are some wonderful pain herbs. Now, we're not talking about something that's going to work as fast or as numbingly as one of the canes, lidocaine, novocaine, but we're talking about something that will take the edge off of your pain. And I've had experiments with these things, and I'll tell you one little story. But some of the pain herbs are things like angelica, black call, blue violet. Some of the sedative herbs like chamomile or catnip are very, very nice herbs to take away the edge off the pain. The one I like the best is white willow. It's basically called white willow bark. It's the inside layer of the bark of the white willow tree. And it's been used for many, many years, matter of fact, centuries, as a pain reliever. The old folk medicines, matter of fact, that's how we found out about it. I say we, the drug manufacturers, they found this salicylate in the white willow bark was a pain reliever, so they sort of extracted it and synthesized it and made a thing called aspirin. But still the white willow bark works quite nicely. A few years ago I was working on a table saw and I cut the tips of 2 of my fingers off. And quite painful experience, right down to the bone, the nails, the skin, the whole thing was gone. And I was in a lot of pain, but I wanted to do everything just the way we're supposed to do it. I've been in natural medicine for a long time. And so when I walked into the lifestyle center, the first thing they said, "Are you allergic to any of the canes?" And I said, "I don't want any of the canes. Give me a glass of ice water." So they took a glass full of ice and water and they stuck my fingers down in the ice water. And that is a good pain reliever. Left it in there for quite a while, brought it out and they scrubbed it off because I had once read that scrubbing a wound, of course we have to do that anyway to clean it, but it somehow lessens the pain. I can't attest to that right now because it really did hurt when they were scrubbing those little things. But from then on, someone had made me a quart of white willow bark tea. And I drank that and I got some white willow bark capsules. I would take those things each night and within 3 weeks, my fingers, using some other herbs for cell growth proliferation, like comfrey, within 3 weeks I could play the guitar again. And that was my fingers that you push on the strings. In 3 weeks I could play with very, very little bit of pain. And so I believe in the pain herbs. I believe that God has given us everything that we need to deal with it. As a matter of fact, I found out just the other day that 40% of the drugs that we have today came from plants in the rainforest. And so I think that God, no, I don't think, I know that God has everything that we need out there in nature. We just have to be patient enough to first to find it and be patient enough to let it work in its own time. God does everything right in His own time. And so I encourage you to look into the pain herbs and to try them when you have the pain and do the other things that we've been talking about. And Dr. Thrash has a few more suggestions. Dr. Thrash.
Not only is pain dealt with directly and as a as a particular thing that we must say, this we must treat. But also, for a person who is in a chronic pain, we will often need to treat them for their depression, because they begin to think, this pain is not going to go away. I'm going to always have it. And as they begin to think that way, and they see the limitation that they have with their lives, with the things that they love to do, and the way that they have always carried on their affairs, and now they're unable to do that because of pain. As they see this, then they're likely to get depression. And so what one must do for the person with depression is to treat that. That should be treated with exercise. It should be treated with extreme regularity. That is, going to bed on time, getting your meals on time, doing exercise on time. All of those things must be done with regularity. But then I like also an herbal remedy for depression. The one that I like the best is probably St. John's wort. St. John's wort is characterized by the ability to relax the body. It is also characterized by the ability to elevate the spirits a good bit. So the person with depression should always try to use some kind of relaxing herb like St. John's wort. Now, don't sell exercise short. Exercise for depression is one of the most important things that we can do. Every day, the person with depression should get out of doors, because being in the out of doors will also help the person with depression. The diversion that one gets from looking at the birds and the trees and the flowers, all of these kinds of things can help the individual who has depression. Then some of the herbs like catnip tea can also be very helpful in depression. And so as we think about the total treatment of the person with pain, we need to think also about dealing with depression and helping them do some of the things that they once could do and now they cannot do. Have you ever wondered what God is going to do with all the pain receptors that we have in the body? They're among the most numerous of all the nerves that we have in the body. And God is a very conservative God. He has some use for every part of the body that we have. And while I don't know what it is that God has for us, I do believe that He is going to do something very wonderful with our pain receptors in the earth made new. It's worth waiting for.